Hello, everybody. It's Trina, the director of Azurite, back again to say hello. I was just thinking of a few questions that come up a lot, and I wanted to answer for you. And also, my hair. I've been at workout. First of all, I'm going to be there next month. Colin will be there this month, and then I don't know how long I'll be there. I'm going with the waves. So, a few questions. Our hospital, we're not part of any hospital in Bangkok. We rent out the operating room in the the hospital rooms. So, we will give you the info. We're part of the Bangkok network of hospitals that we use, and we just started a new one too. I can never say the words. You can write the staff and they'll explain. We do have a tendency to use Bangkok 8, and that's when it's in the New Zealand 7 Sharp documentary where you see Theopong and myself and a client, and you'll see us in the rooms and at the hotel and the whole bit. It's dated, and actually they're building a new one, but the ICU is incredible. And anybody knows us, we do a lot of heavy-duty surgeries, a lot of weight loss, skin removal, heavier bodies, heavier BMI, older people. So we need a really good ICU. And for baby surgeries, maybe a facelift or something, we'll go over to the new one. Is it now or I don't know. Ask the staff can write and tell you. It's no big deal to me. It's a great hospital. Dated, yes, but our staff takes you to everything. It takes you back, takes you to our clinic, we handle everything. You don't need to worry about that. Do get your insurance, you guys. Don't wait until you get over there because insurance is invalid then. It's just to help you in case you got a blood clot or something out of the ordinary, but we don't accept your case unless you're healthy. That means good EKG, good full blood count. And they will zap you. We've been turning away a couple of months now, and I hate doing it. And it doesn't matter how much your cardiologist or your GP says you're healthy. If Bangkok says you're not healthy, you're not healthy. I have never had a near miss on any client. We're not about to because a client pushes us too far. Mentally be ready, emotionally be ready. Are we great? Yes, but you still have your part in this too. Facelifts. People have been asking me a lot how quickly they can be out in the real world. If you're getting your eyes done or fat transfer, that does knock you around. They get it deep purple here, and under the eyes get swollen, or if you're excess age, you'll get a little pocket here because the skin's so thin. And I would say by the time you leave, that's 13 nights in Bangkok, by the time you leave and you get back, maybe a little concealer. The 3rd week you look pretty good, 4th week you look really good. So if you're in a really important job, 4th week, but a normal job, 2nd week, it just depends what you're doing, but it's not like you're gonna be ghastly looking. You're gonna wanna leave the hotel with sunglasses and a hat right in the beginning. Get out there, have a good time. We do some of the strongest facelifts worldwide, so you're gonna be really tight in your cheeks and the lower eyes pull down, and your neck's gonna feel like you're strangling to death at first. I've had a few clients that they think they're dying, and it's claustrophobic. It's normal. That's how you get those beautiful necks, right? I see all these deep plane and saying all this, and I see a client 6 months later and they're already folding, getting jowls, and their neck doesn't look real defined. The only way for a person with a thick neck, that means liposuction, and jawline lipo, not lipo here, jawline, so it redefines the neck, and then pull up. It's the only way, and most doctors don't know how to do it. Most doctors don't do it. So vertical restore is considered one of the best strong natural facelifts in the world. And as anybody that follows the Dr. Amir, I think he's 175,000 Australian compared to our 17,500, and ours is everything: eyes, lip lift, fat transfer, hotel, aftercare. So yes, we do extraordinary work. just know that, you know, you are going to be a little banged up for a bit. You're going to feel numbness. You're going to feel twitching. But to the public looking at you, after a few weeks, you look pretty good. By the first month, you're going to look really good. Let's see. Get your insurance, as I said. We do make it mandatory. We'll give you the 2 options. We have a beautiful staff that takes care of you. From the time you book, we send you a quote. If you want to accept it, you accept it by paying, of course. Otherwise, you know, someone was talking to me recently, oh yeah, you're holding a date. No, I'm not. No, I can't hold a date. For super people, we hold a date. Now let's get over to that super. Super funds for Australians is when they're using their pension, their retirement, whatever, for body surgeries. It's illegal not to pay immediately upon approval. It's part of your booking. You'll see all the terms. If for any reason your invoice is different than the amount, you have to show us what they actually paid out. You have to. It's very important you follow the process of the ATO because they're very strict. We have been audited, and they've audited our clients, and they've audited our doctor in Sydney. So we're very, very strict because there are people that try to take out money and take off with it, and you can't do that. So the staff picks you up at the airport in Bangkok. There are 2 you can go to. We pick you up, bring you back to the hotel. Hotel's lovely, a buffet breakfasts for a companion too. If you're having a body surgery, you do check out during your surgery. So if you have a companion, they have to stay on the couch with you at the hospital, or you can just extend your night. It's not that much. Facelifts, we do have continuous stay, so that's pretty cool. Companions are free. Look, there's no one. I don't think any company in the world is as great as us, and that sounds really arrogant and cocky, but because we put in so much into you, you know, from me, the one-on-one describing the best thing for you, to Alessandra, Savannah, Colin, everybody hands-on, making you happy and healthy. And then you got Nat, Pat, Jazzy, and Bangkok, and Mr. Nine. So who has these things? Even if you went and spent $80,000 for the same facelift in Australia or New Zealand or etc., you don't have anybody taking you and taking care of your daily wound cleaning and all those special. You feel like a princess or a prince, you know? How often in our lives are we spoiled? However, we do ask you to do your part. Be emotionally ready. Don't drug up in Bangkok. You're not going over there to do heavy sedation and sleep in bed all day. We need you up and mobile because that's a healthy body. Spiritually be ready. Don't be paranoid. We're all watching you very, very well. An extraordinary team. Been doing this for 15 years. Theapong trusts me implicitly. You can't go direct. Even when you try, it gets shoved back to me. Think about it. Why would you want to anyways? I have all these wholesale prices that I take very good care of you, so it's silly to even to contemplate something like that. If you are wanting to do a second surgery, tell me now, because a lot of you are being shot back now because we're not allowing, maybe in the old days we would do more, but now we might have to do a second session. We're so booked up, we can't change at the last minute. So understand, we're really booked up. I have clients think they could just, something opens. Nothing's opening. It's rare. It might be test didn't come back right, or a second session was canceled. We got it all done in the first, but it's rare. So we're not like other hospitals or doctors where we just play around. We're booked up for several months ahead, and you should appreciate that. You want a great company. You want people that you can trust and feel safe, feel safe. Not just, forget we're expert surgery, that's a given, but the safety, the taking care of you, just the whole attitude. How often can you trust this day and age? Not very often. So just try and think of some things that come up in a lot of questions with hospitals, insurance, going overseas, which way better than staying in your country, I think. You remember, Thailand's part of their GDP, their cosmetic surgery. They're not going to mess around. They're not like Turkey that has you know, like 100 deaths just out of UK in the last 5 or 6 years. I think Thailand's had like 2 or 3 in the last 22 years, and that's from butt implants. And yeah, it's always butt implants. We're not really even doing them anymore. So yeah, we're not going to risk you. We're not going to risk you. You have a great team. So I'm going to be there. Colin's going to be there. I'm sure Allie and James. I don't know about Savannah. So I'll see you guys on the other side, and just get happy. Bye-bye.